let's address something that many women after 65 experience, but rarely feel comfortable discussing. Changes in body odor that can occur as we age, even when we maintain the same hygiene routines we've always followed. If you've noticed subtle changes in how you smell throughout the day, or if family members have gently mentioned something, please know that you're not alone. And more importantly, this is completely manageable with the right knowledge and approach. Dermatologists and geriatricians who specialize in senior health explain that what's commonly referred to as old person smell isn't inevitable or irreversible. It's actually the result of very specific physiological changes that happen as our bodies age, combined with the fact that certain areas of our bodies require different attention than they did in our younger years. The encouraging news is that with targeted adjustments to your daily hygiene routine, you can maintain the fresh, clean feeling you've always enjoyed. Medical research has identified the primary causes behind these odor changes. After menopause, declining estrogen levels affect our skin's natural oil production and moisture retention. Our skin becomes thinner and drier, which can lead to the accumulation of dead skin cells and bacteria in areas we might not think to pay special attention to. Additionally, changes in our metabolism and the way our bodies process certain compounds can contribute to subtle shifts in our natural scent. Dr. Patricia Faris, a board-certified dermatologist who specializes in aging skin, explains that these changes don't reflect poor hygiene habits. Instead, they indicate that our hygiene routines need to evolve along with our changing bodies. Just as we might adjust our skincare routine or dietary needs as we age, our cleansing habits also benefit from some thoughtful modifications. Before we dive into the specific areas that require special attention, it's important to emphasize that this information comes from medical professionals who understand and respect the dignity of aging. These aren't complicated or embarrassing procedures. They're simple adjustments that can be easily incorporated into your existing routine. The goal is to help you feel confident and comfortable in your own skin, which is something every woman deserves, regardless of age. The first area that dermatologists consistently emphasize is behind the ears and around the earlobes. This might surprise you, as it's not an area most people think about when it comes to body odor. However, geriatricians explain that the skin behind our ears produces natural oils called sebum, and as we age, these oils can accumulate more readily due to changes in skin cell turnover. The area behind your ears has many tiny crevices and folds where dead skin cells, natural oils, and even traces of hair products can build up over time. When this accumulation isn't regularly addressed, it can develop a distinctive musty odor that becomes more noticeable as our sense of smell changes with age. Ironically, we might not notice it ourselves, but others might. Here's the simple solution that dermatologists recommend. Each morning and evening when you wash your face, take a moment to gently clean behind your ears with a soft washcloth and mild soap. Pay special attention to the crease where your ear meets your head. And don't forget the area around your earlobes, especially if you wear earrings. This takes less than 30 seconds, but can make a significant difference in maintaining freshness throughout the day. The second critical area is your scalp and the hairline around your face. Geriatricians who work with senior women often observe that changes in hair texture, density, and oil production can affect how well we're actually cleaning our scalps. As we age, our hair might become finer or thinner, which can make us think our scalp is cleaner than it actually is. Additionally, if you use styling products, dry shampoo, or have reduced the frequency of hair washing to protect aging hair, product buildup can occur along the hairline and scalp. This buildup, combined with natural oils and dead skin cells, can create an environment where bacteria thrive, leading to an odor that's particularly noticeable around the hairline and forehead. Trichologists, specialists who study hair and scalp health, recommend that women over 65 pay special attention to thoroughly cleansing the scalp not just the hair strands. When shampooing, spend at least a full minute gently massaging your scalp with your fingertips to ensure you're removing buildup and stimulating healthy circulation. If you wash your hair less frequently, consider using a clarifying shampoo once a week to remove any accumulated products or oils. For women who prefer to wash their hair less often, dermatologists suggest using a damp washcloth with a small amount of gentle cleanser to clean the hairline area daily, especially around the forehead and temples, where oil and product buildup are most common. The third area that requires special attention is your underarms, but not in the way you might expect. While most women are diligent about using deodorant or antiperspirant, geriatricians point out that the products themselves can contribute to odor issues if not properly managed. As our skin becomes more sensitive with age, we might not be removing all traces of yesterday's deodorant before applying today's, leading to a buildup that can actually trap bacteria and create unpleasant smells. Clinical research shows that aluminum-based antiperspirants, while effective, can accumulate on the skin over time, especially when combined with the natural changes in our underarm skin as we age. This buildup can create a barrier that prevents proper cleansing and can even contribute to skin irritation or discoloration that some women notice in their later years. The solution recommended by dermatologists is to incorporate a thorough underarm cleansing routine several times a week. This involves using a gentle exfoliating washcloth or a soft bristled brush to remove any product buildup, dead skin cells, and bacteria. Some physicians recommend using a clarifying body wash or even a gentle facial cleanser in this area, as these products are formulated to remove buildup more effectively than regular body soap. After thoroughly cleansing, make sure the area is completely dry before applying your deodorant or antiperspirant. Many women find that switching to a more natural deodorant as they age actually provides better odor control with less buildup, though this transition should be made gradually to allow your skin to adjust. The fourth area that medical professionals emphasize is your feet, particularly between the toes and around the toenails. Podiatrists who work with senior patients explain that, as we age, several factors can contribute to foot odor that might not have been an issue in younger years. Circulation changes can affect how well our feet regulate temperature and moisture, and if mobility limitations make it challenging to thoroughly dry between the toes, fungal growth can become a problem. Additionally, if you have diabetes or take certain medications, your feet might be more prone to bacterial or fungal overgrowth. Thickened toenails, which are common as we age, can harbor bacteria underneath if not properly cleaned. Even something as simple as wearing the same pair of shoes multiple days in a row can contribute to moisture buildup, and odor geriatricians recommend a daily foot care routine that goes beyond a quick rinse in the shower. Each day, wash your feet with antibacterial soap, paying special attention to the spaces between your toes and around the nail beds. Use a soft brush or washcloth to gently clean under and around the toenails. Most importantly, thoroughly dry your feet, especially between the toes, before putting on socks or shoes. Many foot care specialists suggest alternating shoes daily to allow them to completely dry out between wears, and using moisture-wicking socks that help keep feet dry throughout the day. If you notice any persistent odor, itching, or discoloration around your toenails, it's worth consulting with a podiatrist, as these can be signs of fungal infections that are easily treatable but won't resolve without proper care. The fifth area that requires special attention is your clothing, particularly undergarments and items that come into direct contact with your skin. Textile scientists who study fabric and odor retention explain that, as our bodies change with age, the way our clothing interacts with our skin also changes. Natural fabrics that once felt fresh all day might now retain odors more readily due to changes in our body chemistry and the amount of natural oils our skin produces. Geriatricians often observe that women over 65 benefit from washing their clothes, especially undergarments, in hot water when the fabric care instructions allow. The natural changes in skin pH and oil production that occur with aging can make it more difficult for regular cold water washing to completely remove all traces of body oils and bacteria from fabrics. Additionally, dermatologists recommend paying attention to how long you wear certain items before washing them. Bras, for example, might need to be washed after each wear rather than the 2 or 3 wears that might have been acceptable in younger years. The natural changes in skin moisture and oil production mean that fabrics can harbor bacteria more readily, even if they don't appear or smell dirty to you. Many women find it helpful to have several sets of undergarments in rotation, allowing each set to air out completely between wears. Natural fiber fabrics like cotton and bamboo tend to be more breathable and less likely to retain odors than synthetic materials, though this varies by individual preference and skin. Sensitivity, the sixth and perhaps most important area that medical professionals emphasize, is what they call the personal care zone, the intimate areas of your body that require special attention as hormone levels change with age. Gynecologists and geriatricians explain that declining estrogen levels significantly affect the delicate balance of the vaginal and vulvar area, making proper hygiene both more important and more delicate than it was in younger years. After menopause, the natural pH of the vaginal area becomes less acidic, which can allow harmful bacteria to flourish more easily. The tissues also become thinner and more sensitive, meaning that harsh soaps or over-cleansing can actually make odor problems worse by disrupting the natural protective barriers. At the same time, decreased natural lubrication can lead to accumulation of dead skin cells and bacteria if gentle. Appropriate cleansing isn't maintained. Dr. Mary Jane Minkin, a clinical professor of obstetrics and gynecology at Yale School of Medicine, emphasizes that this area requires a delicate balance. Over-cleansing can lead to irritation and actually increase odor-causing bacterial growth, while under-cleansing can allow natural secretions and dead skin cells to accumulate. The medical recommendation is to cleanse this area daily with plain warm water or a very mild, unscented cleanser specifically designed for intimate use. Avoid regular body soaps, which can be too harsh and disrupt the natural pH balance. Pat the area dry gently with a clean towel, and consider wearing breathable cotton underwear that's changed daily. Many gynecologists also recommend that women over 65 avoid douching entirely, as this can disrupt the natural bacterial balance and lead to increased odor problems. If you notice any persistent, unusual odors, itching, or discharge, it's important to consult with your healthcare provider, as these could indicate infections that are easily treatable but won't resolve without proper medical care. Now that we've covered all 6 critical areas, let's talk about creating a comprehensive daily routine that incorporates these recommendations without making your hygiene regimen overwhelming or time-consuming. The key is to think of these adjustments as refinements to your existing routine rather than completely new obligations. Start your day with what dermatologists call targeted cleansing. As you wash your face each morning, simply extend your routine to include cleaning behind your ears and along your hairline. This takes perhaps an additional 30 seconds, but ensures these often overlooked areas get daily attention. When you brush your teeth, use this time to also inspect your scalp and hairline in the mirror, checking for any product buildup or areas that might need extra attention during your next hair wash. During your shower, medical professionals recommend working from top to bottom with your cleansing routine. Start with your hair and scalp, giving yourself plenty of time to thoroughly massage the scalp and rinse completely. Then move to your face and behind your ears, followed by your underarms with special attention to removing any previous day's deodorant buildup. When cleansing your intimate areas, gynecologists suggest doing this toward the end of your shower routine to ensure you're using clean hands and that any soap residue from other parts of your body has been rinsed away. Finish with your feet, taking time to clean between toes and around nails, And always end your shower with a thorough rinse to remove all soap residue. The drying process is just as important as the cleansing, according to dermatologists. Take time to thoroughly dry all the areas we've discussed, paying special attention to between your toes, under your arms, and in any skin folds. Many women find it helpful to use a hairdryer on a cool setting to ensure areas like between the toes are completely dry, especially if mobility issues make thorough towel drying challenging. Product selection becomes increasingly important as we age. Dermatologists recommend choosing gentle, fragrance-free products whenever possible, as mature skin can become more sensitive to harsh chemicals and artificial fragrances. Look for cleansers labeled as pH balanced or gentle, and consider products specifically formulated for mature or sensitive skin. For deodorants and antiperspirants, many geriatricians suggest trying different formulations to see what works best with your changing body chemistry. Some women find that natural deodorants work better than they did in younger years, while others need clinical strength antiperspirants. The key is finding what keeps you comfortable and confident throughout the day. Clothing choices also play a role in odor management. Textile experts recommend natural fibers like cotton, linen, and bamboo, which allow better air circulation and moisture wicking than synthetic materials. If you prefer synthetic fabrics for their easy care or wrinkle resistance, look for those specifically designed with moisture-wicking properties. It's also worth considering your laundry routine. Geriatricians often recommend washing undergarments and any clothing that comes into direct contact with your skin in the hottest water the fabric can safely handle. Adding a cup of white vinegar to your rinse cycle once a week can help remove any soap buildup and naturally deodorize fabrics. Without harsh chemicals, environmental factors in your home can also affect personal freshness. Indoor air quality specialists note that proper ventilation in bathrooms and bedrooms helps prevent moisture buildup that can contribute to bacterial growth on skin and clothing. If possible, use exhaust fans during and after showers, and ensure your bedroom has good air circulation. Diet can also play a role in body odor, though this varies significantly from person to person. Nutritionists who work with seniors note that staying well hydrated helps your body efficiently eliminate waste products that can contribute to odor. Some people find that reducing consumption of strongly flavored foods like garlic, onions, or spicy dishes can help, though this isn't necessary for everyone. Certain medications commonly prescribed to seniors can also affect body odor or skin sensitivity. If you've noticed changes in your natural scent after starting new medications, this is worth discussing with your healthcare provider. Sometimes simple adjustments to timing or dosage can help, or your doctor might recommend additional hygiene strategies. Regular medical checkups become even more important as we age, not just for general health but also for addressing any changes in body odor that might indicate underlying health issues. Endocrinologists note that thyroid problems, diabetes, and other conditions that become more common with age can affect body chemistry and natural scent. Early detection and treatment of these conditions often resolves any related odor issues. The psychological aspect of feeling fresh and confident shouldn't be underestimated. Psychologists who work with seniors observe that women who feel confident about their personal hygiene tend to be more socially engaged and maintain better overall mental health. The simple act of knowing you've taken care of these details can boost your confidence in social situations and help you maintain the active, engaged lifestyle you deserve. Remember that these changes in your body's needs are completely normal and nothing to be embarrassed about. Every woman who lives long enough will experience these physiological changes. They're simply part of the natural aging process. The difference is in how we adapt our routines to work with our changing bodies rather than against them. It's also important to be patient with yourself as you implement these changes. It might take a few weeks to establish new routines and find the products that work best for your individual needs. Don't hesitate to ask your healthcare provider for specific recommendations, especially if you have sensitive skin or other health considerations that might affect product choices. Most importantly, remember that taking care of yourself isn't vanity. It's self-respect. You've earned the right to feel comfortable and confident in your own skin, and these simple adjustments to your hygiene routine can help ensure that you continue to feel fresh and attractive throughout your golden years. Your comfort and confidence matter. You've lived a full life, contributed to your family and community, and you deserve to feel good about yourself every single day. These medical recommendations aren't about conforming to unrealistic standards. They're about helping you feel your best so you can continue to enjoy all the activities and relationships that bring meaning to your life. If you found this medical advice helpful and practical, please give this video a thumbs up and subscribe to our channel for more health and wellness content, specifically designed for women in their golden years. Your well-being matters, and we're here to provide the reliable, respectful information you need to feel confident and healthy. I'd love to hear from you in the comments. Have you noticed any of these changes as you've aged, and do you have any additional tips that have worked well for you? Your experiences could be incredibly helpful for other women who are navigating these same changes. And if you're interested in more content about maintaining confidence and health as you age, be sure to check out our video about skincare routines that actually work for mature skin. Remember, taking care of yourself is an act of self-love, and you deserve to feel wonderful at every stage of life.